हेलो फ्रेंड्स। तो चलिए आज का नया टॉपिक चालू करते हैं, दैट इज़ एंटी अंजाइनल ड्रग्स। एंटी अंजाइनल ड्रग्स आर वेरी इंपॉर्टेंट क्लासिफिकेशन ऑफ द ड्रग्स यूज्ड इन द सेकंड ईयर MBBS final examination. So we will move towards anti-anginal drugs first. This is the classification of the anti-anginal drugs which is seen in the screen. There are 4 classes of the anti-anginal drugs, as you can see. Anti-anginal is very important question. So anti-anginal drugs, first category of the drug which can be used against the angina is nitrates, second one beta blocker, third one कैल्शियम चैनल ब्लॉकर एंड फोर्थ इज पोटेशियम चैनल ओपनर्स। हम ये चारों प्रकार की ग्रुप्स अंजाइना के अगेंस्ट यूज कर सकते हैं, लाइक नाइट्रेट, बीटा ब्लॉकर, कैल्शियम चैनल ब्लॉकर एंड पोटेशियम चैनल ओपनर। आपको ये बस ये चार ग्रुप अच्छे से याद करने हैं। फर्स्ट वन नाइट्रेट, बीटा ब्लॉकर, कैल्शियम चैनल ब्लॉकर एंड पोटेशियम चैनल ओपनर्स। देखिए एक नाइट्रेट है, 2 ब्लॉकर्स है, एक ओपनर है। ओके, तो लेट्स सी ईच ऑफ देम वन बाय वन। The first group, nitrate. The example of the nitrate is nitroglycerin or isosorbate mononitrate or dinitrate. अब हम सबसे पहले देखते हैं द मैकेनिज्म ऑफ एक्शन ऑफ द नाइट्रेट। नाइट्रेट क्या करता है? नाइट्रेट विल रिलीज द नाइट्रिक ऑक्साइड from the nitrate group, then that nitric oxide will stimulate the guanyl cyclase. The guanyl cyclase will increase the cyclic GMP. Cyclic GMP is the cyclic guanyl monophosphate that will cause dephosphorylation of the myosin light chain kinase. और मायोसिन लाइट चेन काइनेज का डिफॉस्फोराइलेशन होने के बाद वहाँ पर होता है डिक्रीज इन द कैल्शियम कॉन्सेंट्रेशन इन द साइटोसोल। साइटोसोल में कैल्शियम का कॉन्सेंट्रेशन कम होगा, और अपने को पता है कि कैल्शियम इज द इम्पोर्टेंट आयन फॉर द कॉन्ट्रैक्शन ऑफ द मसल इन आवर बॉडी। तो जैसे ही कैल्शियम का कॉन्सेंट्रेशन कम होता है, दैट विल लीड टू द रिलैक्सेशन ऑफ द वस्कुलर स्मूथ मसल। तो वस्कुलर स्मूथ मसल का रिलैक्सेशन होता है बाय द नाइट्रेट, बाय रिलीजिंग ऑफ द नाइट्रिक ऑक्साइड। दैट इज द मैकेनिज्म ऑफ एक्शन ऑफ द नाइट्रेट। एंड थेरापेटिक यूज क्या है नाइट्रेट का? तो थेरापेटिक यूज इज दैट वी कैन यूज द नाइट्रेट इन एक्यूट अटैक ऑफ अंजाइना एज अ प्रोफाइलैक्सिस ऑफ अंजाइना, कि अंजाइना ना हो। उसके बाद वेरिएंट अंजाइना, अनस्टेबल अंजाइना, दीज आर द ऑल काइंड्स ऑफ अंजाइना इन विच वी कैन यूज नाइट्रेट एज अ ड्रग. Then we can use nitrate in the hypertensive emergencies, congestive heart failure, acute myocardial infarction, then biliary colic and cyanide poisoning. Okay, then the ADRs is adverse drug reaction of the nitrate. The adverse drug reaction of the nitrate is due to vasodilation mainly, that is headache, hypotension, tachycardia, palpitation, weakness, flushing and syncope. These are all the adverse drug reaction related to the nitrate particularly. Okay. After the first group nitrate, let's move towards the second group, beta blocker. The beta blocker can be of two types, that is non-selective beta blockers and selective beta blockers. The examples are propranolol, timolol, ismolol and atenolol. Let's go to the mechanism of action of the beta blocker. The mechanism of action of the beta blocker is such that the beta blocker will block the beta receptors on the heart, and that will lead to the decrease in the heart rate and decrease the force of contraction of the heart. That will reduce the cardiac work, and after reducing the cardiac work means the myocardial oxygen consumption will be decreased. That myochondrium will require less oxygen for its activity. That is the way beta blocker will work and reduce the oxygen consumption and support to the angina. After the mechanism of action, we will move to the therapeutic use of the beta blocker. Therapeutic use is same as the nitrate. We can use it in the acute attack of angina, prophylaxis of angina. Just the difference is that we can't use the beta blocker in variant angina. Variant angina में beta blockers are contraindicated. So that's the only difference. Apart from that, all the indications are same. That is acute attack of idea, then prophylaxis, unstable angina, hypertension, congestive heart failure, acute myocardial infarction, all that. Okay, then adverse drug reaction of the beta blockers is that bronchospasm in the asthma, then bradycardia and heart block. These can be the adverse drug reaction to the beta blockers. After beta blocker, let's move to the third group of drugs used against the angina, that is calcium channel blocker. The examples of the calcium channel blocker are verapamil, diltiazem, nifedipine and amlodipine. Okay, let's see the mechanism of action of the calcium channel blocker. The calcium channel blocker will block the voltage gated L type of calcium channel by binding to the alpha subunit. Calcium channel blocker will bind to the alpha subunit and it will block the L type calcium channel. So as there is a blockage of the calcium channel, the entry of the calcium will not be there in the cell. So excitation, contraction, coupling in the heart and vascular smooth muscle will stop. As excitation, contraction, coupling will not happen, then force of contraction will not happen, and it will reduce the heart rate, that will reduce the heart pressure on the heart. That's the way we can use calcium channel blocker against the angina. The therapeutic use of the calcium channel blocker is exertional angina, variant angina, unstable angina, hypertension, supraventricular arrhythmia, hypertrophic cardiopathy, migraine, Raynaud's phenomena, and premature labor and cerebral vasospasm like condition. The adverse drug reaction of the calcium channel blocker are same as we have seen in the nitrate and beta blocker. There are exhaustive list of adverse drug reaction against the calcium. You can pick any of you whatever you want. Okay, after calcium channel blocker, let's go to the fourth and last group. There are other group, but that not very significantly used in the treatment of the angina. The fourth group is potassium channel openers. The example of the potassium channel openers is nicorandin. The nicorandin work by the action of opening the ATP dependent potassium channel. As the potassium channel will open, the potassium efflux will happen, and due to potassium there is a hyperpolarization that leads to venodilation and arteriodilation that will reduce the preload and afterload on the heart. Due to this preload and afterload reduction in the heart, the heart work or the work on the heart will reduce, and that will decrease the angina. Or either it can release nitric oxide as we see in the nitrate, and that will increase the cyclic GMP, that is guanylyl monophosphate. Then it will do the relaxation of the vascular smooth muscle. Again, vascular smooth muscle will relax and the working of the heart will reduce. This is the way potassium channel opener can act like a nitrate also. The adverse drug reaction of the potassium channel openers are headache, hypotension, palpitation, flushing, nausea, vomiting and ulcers. After that, all the four major groups we have four minors like chote group that we can use against the angina. That is antiplatelet drug like aspirins, then statins, then ranolazine and trimetazidine. These are not classified under these four groups, but it can be used as a anti-anginal drugs, and we will see it antiplatelet and statin in their respective groups or respective chapters also. So the four major categories of the anti-anginal drugs are here, that nitrate, beta blocker, calcium channel blocker and potassium channel opener. After that four, you can add four more group of categories in it, that is antiplatelet, statin, ranolazine and trimetazidine. Okay, so these are all the drugs. You have to just read, and once or twice or thrice just revise or read that first page only. That will be sufficient for the anti-anginal drugs. Thank you so much.